Hi, welcome to today's webinar on childhood cancer advocacy and policy priorities for 2025 and the 119th Congress. I'm Jess Keene. I'm the Communications Director for Children's Cancer Cause, and I'm here to introduce this webinar, tell you a little about us, and then turn it over to our presenters. So this webinar aims to help childhood cancer advocates better understand the fast-changing policy landscape in Washington, D.C., and what it might mean for our community's policy priorities in 2025. So we'll discuss newly introduced legislation, the outlook and hurdles around federal funding for childhood cancer research, and other policy priorities like survivorship and protecting Medicaid. Plus, we'll cover the basics of the legislative process and effective advocacy strategies. So this webinar is being presented by Children's Cancer Cause, which is a leading national advocacy organization dedicated to creating a brighter future for children with cancer, survivors, and their families. We promote policies and programs that aim to accelerate the development of safer, more effective cancer therapies for children and better address the unique needs and lifelong health challenges experienced by childhood cancer survivors and their families. So we're advocates ourselves. We work closely with leaders in Congress, federal agencies, industry, and the broader cancer community. And we serve as a dedicated voice of children with cancer, families, and survivors in national debates on healthcare and cancer policy. We also aim to empower survivors and families to be effective advocates themselves by arming them with information, resources, and advocacy training like today's webinar. So I'm happy to introduce you to our policy team to lead you through today's webinar. Steve Wasala is our Chief Executive Officer. He has over 3 decades of experience in executive leadership at health organizations and nonprofits. Steve will be joined by Sue Emmer, our longtime policy counsel. Sue is an expert in national health policy with experience on Capitol Hill, and she provides strategic advice and support on our federal policy agenda.
I am Steve Wasala, Chief Executive Officer for Children's Cancer Cause, and pleased to welcome Sue Emmer. Welcome, Sue.
Thank you, Steve. I'm Sue Emmer, and I am a longtime public policy consultant to Children's Cancer Cause.
So, Sue, we have a lot to talk about today. As many of us have read in the press, there's been a lot of changes in Washington these past few weeks. The next few weeks are going to be critical for federal funding for the government budget. We also have new legislation for childhood cancer and our upcoming action days when volunteers will descend upon the Capitol from all over the country, children with cancer and their families, to advocate for better laws for our communities. So quite a lot going on. I guess I wanted to just start and say, you've been involved in helping to pass legislation in childhood cancer in our community for so many years. And what are the changes, in Washington now that are happening? What do you think they mean for our community and childhood cancer patients?
Thank you, Steve. It is really an interesting time. As everyone knows, we're in the middle of a new administration and a new Congress as well, and with many, imminent deadlines coming. I'm going to talk really specifically about what I think it means for our community. First point I want to make, and I think it's critical, is childhood cancer is a bipartisan issue. It always has been, always will be. We're very lucky that on almost all of our major initiatives, it's always been handled in a bipartisan, bicameral fashion. And I think moving forward in that way will be very helpful to us. So in that regard, I think we'll see a fairly seamless transition of those who actually champion our issues. And in that same regard, our issues are not particularly controversial. So I think that's very important. I will say, however, there are truly some short and long-term deadlines that we're facing. And some of those are not specific to our community as well. But, we'll talk about this probably throughout the presentation. But we are facing a big funding deadline, as you mentioned, Steve, Right now, our government is under a continuing resolution through March 14th. And what that means is after that date, we will, without passage of a new funding bill, we'll go into shutdown. So that will impact childhood cancer. That will impact everyone, all the agencies and programs which serve us. So that's a short-term issue. Congress is hard at work to come up with a bill to resolve that. It's unclear at this point, really, the direction it will go, and I'll wait probably later to talk in more detail about it. But that really does present us with a change. And, I think as part of that process, there's going to be something called a reconciliation. And that reconciliation is a separate initiative from a funding bill where Congress has the opportunity to enact policy changes. So we could see policy changes there. And again, we're going to talk in great detail about our agenda and how it fits into that, particularly about the drug development issue. And then, in terms of long term, uh, we'll see if there's some sort of greater reforms, things like NIH reform and other efforts that really could impact our community. NIH reform is something that the majority parties have talked about for some time, and this reconciliation and funding bill, we could see that happen.
Um, I wondered if you could just talk about how things actually become law and what the process is in both the House of Representatives and the Senate for people to better understand.
Sure. And I've kind of done this backwards in that I've talked about this already, big picture. So I'm going to take a step back. I'm going to go through sort of the ideal, and then I'll go through what we see happening, because in many cases they're very, very different. So the what you've all learned in your government and civics classes are that the House passes a bill, the Senate passes a bill. In that process, it goes through regular order where there are committee hearings and the relevant committees pass the bills, and then the House and Senate bills are reconciled and the president signs it. This does still happen. One example is the STAR Act, our signature legislation within our community. We at Children's Cause strongly support that bill, as does the alliance we work in. And that bill went through regular order. It passed on its own with widespread support. Uh, while this is a important accomplishment, it doesn't always happen this way. And in fact, it's less likely it happens this way. I think the statistic is that about 1% of bills pass through regular order in that way. So what we tend to see these days is what I referenced earlier, where we have these big, high stakes packages, which include many different diverse bills that span issues. So often you'll have health bills with, say, environmental bills or tax bills, and they're put into something like a government funding bill, which is must pass, or the government will shut down, or this reconciliation bill, which has very specific instructions, so it can pass with a lower majority than usually required. And that provides an opportunity to put together many legislative priorities that different lawmakers have been working on. So you have these two different processes, one where you have the regular order where the bill goes through the committee process, passes the bodies, and is signed by the president, and then the other where you have various bills that are placed in these big must-pass packages, and then everyone sort of gives a little on those, and they also then are passed by Congress, and then signed into law. Those are the big things we see. House and Senate process can vary a little. I don't think we need to get into that, but I think I've covered most of the main pieces.
Great. Thank you. So uh, the action days that will take place on the Hill this year will have record attendance. In fact, they've had to shut down attendance early because the response was so overwhelming. And as a veteran of, past action days, what has your experience been, and what do you think participants most get out of it?
Yeah, well, I'm thrilled that we've had such a robust response, Steve. And I'll say that I started my career working on Capitol Hill. I was a healthcare staffer when I was in my 20s. And I say that because those of you who are advocates, those of you who are attending this Hill Day or others, one of the first things you'll see is most likely a very young staffer. Do not be deterred. These are hardworking individuals that are really um, excellent conduits to the lawmaker that they're representing, and very important meeting. So I'll talk about a couple things that I think makes for a good meeting. The first is for any advocates to know that it is their right, indeed the responsibility of the office they're meeting with as a constituent to see this individual. So um, these are not partisan meetings, and in fact, attendees should never talk about their partisan affiliation or who they voted for. That's irrelevant to the meeting where really you're there as a constituent. Number one. Number two, real world experiences matter uh, just such a significant amount in these meetings. So it would tell advocates to really tell their story, explain how it fits into the, you know, area that the member of Congress represents. So for instance, I was seen at this children's hospital in your district, or alternately, I had to travel to another area because services weren't available, which is not an unusual outcome. So again, really make it personal and tell your story. That's why you're there. You're not there to be a policy expert, so don't get concerned if you're unable to go through every policy point you've been briefed on. You'll have materials you can leave. There's always opportunity for follow-up after. So that's probably, while important to make your ask, uh, you know, probably not to worry if in fact you don't feel like you're a policy expert. Another point that I think I would say is practice a little. Think about how you want to handle it. You may not have a long period of time, so you may have to compress your presentation. You may have to stand. There are all sorts of variables that come into these meetings, and I wouldn't worry if they happen. It doesn't mean that an office doesn't care about you. It's just that these offices are small, and this is key meeting time, and thus space is tight. Also, I guess what I always say is have fun. You'll start to have fun by your second or third meeting for those of you who are doing this for the first time, and just kind of enjoy the fact that you're part of the lawmaking process.
And I think you make a very good point that although the staffers may appear to be young, and many of them are, they have a huge influence, I think, in helping to shape the health agenda for their member, and are very committed to hearing the stories of patients and constituents, and how that fits into the larger health agenda that their office is pursuing.
Steve, one thing I might add too, also don't be afraid to explain issues that are brand new to offices. For instance, at Children's Cause, we really focus a lot on survivorship. And even for more experienced health policy, uh, staffers, this may be a relatively new concept. Late effects obviously is a very significant issue in our community, but somewhat unique to us as well. So something like that may take a little extra explaining.
Great point. Thank you. So at the end of last year, we were disappointed that the childhood cancer package that contained five bills and had been reached the House floor for a final vote and final funding didn't pass. The final funding bill didn't pass. But earlier this year, we saw the introduction of Give Kids a Chance, bill, which includes several of the provisions from those bills. And we're very pleased because it would allow the FDA to have greater authorities to direct companies to conduct combination studies, as well as give them additional enforcement authorities that they currently don't have. So if a company is late to do their required pediatric studies, there really aren't many enforcement provisions, but this bill would allow the FDA to have greater authority to penalize companies for doing what they're supposed to do, which we think represents more of a parity between adult drugs and pediatric drugs. Was wondering if you could comment on where you think we were in December and where we are now, just in terms of moving ahead with some of these bills.
Sure. Thank you, Steve. So this has been a really exciting and interesting process for us. As you noted, we were pivotal in working on a piece of the Give Kids a Chance Act, and that is the Innovation in Pediatric Drugs Act, which included several significant provisions, one of which gave new authority, not new, but parity to allow children's drugs to have the same authority as adults do. There's certainly other parts of the Give Kids a Chance we support as well. It's really very important for our community that the entire package passes. As you noted, Steve, that those bills were put together at the end of the year. They passed out of committee. I talked earlier about the process, and we had regular order in that the House Energy and Commerce Committee considered these 5 bills as a package. Often when bills are packaged, they're stronger. They were included together, and then they were included in the first and second big high-stakes packages I talked about earlier. They were not, however, included in the final package that passed Congress, and that was very unfortunate. So the good news is the bill Give Kids a Chance Act has been reintroduced in a bipartisan fashion, and it is, we hope and think, poised to be included in the March package. The bill is unchanged, which I think is very important because it's already gone through that committee process. And I think there's a very good chance they'll be included in this package. As I said earlier, the March package will probably include some sort of funding. It's not clear whether it will be a continuation of the existing funding package for fiscal year 25, or it'll be a new bill, and then it'll include some new, what we call authorizing legislation under reconciliation. And thus there will be space to include this very popular package. I think another reason, Steve, that there's a really good chance this will go through is there's at least one provision of that package that is what we call an expiring authority. The priority review voucher technically expired, and if it is not included, that authorization will fall away, and it's very important and popular program. So I think that's a key driver, as are all of these. So I think because there's strong support, and in fact also support on the Senate side for this provision, we have a good chance it'll be included. I will say, however, we're kind of in a new period. I think we're all, watching and learning. And I've been doing this a long time, but I will say it's a new period for all of us. So ultimately, what the rules are could change, and the sort of process of including bills in here could change, and so I don't want to guarantee anything, but I think because there was strong support for this before, it's not heavily controversial. There are some pieces where there's some disagreements, but it does have bipartisan support. We have a very good chance this will be included.
We're very delighted that the Childhood Cancer Caucus is one of the largest, if not the largest, caucuses on the Hill, enjoying widespread bipartisan support. And the Give Kids a Chance Act had multiple members from both sides of the aisles to support it. So that I think also bodes well for this bill as well. Any other thoughts there?
Yeah, I mean, I should give out a shout out here to Representative McCall, who is, I think, one of the original founders of the caucus, was a bill lead on Give Kids a Chance and is so again, has been a steadfast supporter and is indeed the sponsor. And then we have a new Democratic lead. SU had been the longtime lead on most of the pieces of the Give Kids a Chance Act as well.
The other thing that our community is very concerned about, and we'll be talking with our representatives, is the sort of continued uninterrupted funding in biomedical research, especially because our population is small and childhood cancer is a set of rare diseases, and that often don't have a lot of incentive for uh, pharmaceutical companies to study because the market is so small. So the importance of the federal research work is paramount to future cures and treatments and solutions for survivors who face a lifetime of health challenges due to the treatment they received. Um, we issued a statement saying that we oppose any changes in the interruption of biomedical research, and that we really rely on the NIH and the NCI to do what they do, which is to pursue science. So that's something that we're very conscious of and will be working towards there. Would you have anything to add on that, Sue?
Yeah, well, this is very important, and we've the Alliance and our Hill Days have a long track record of supporting continued funding for our priorities. And, we've been fortunate up to this point that there's been very strong support for funding the STAR Act, for funding the CCDI. We've also supported the larger, cancer funding at NCI and NIH. I think here I would go, as I said earlier, talk about examples where we can. Note that we've made gains in the research arena slowly over time through the strong bipartisan support we've had for the funding. And just to stress that any gaps could be very detrimental. So I've raised this a couple times now. I've talked about the fact that we have a deadline of March 14th, and the fact that the Congress will consider, a different forms of the package to extend government funding. And so what we really support is continued funding, both big picture, but then of our programs at that time. And the fact that if we have a any kind of stoppage, that could be dangerous, and also obviously decreases in this funding could be dangerous as well. That really we've made gains with what we've had and done a lot with that amount. We've been very lucky to have it be stable funding, and we need to continue that. I want to take a second here, Steve, because I've talked about it so much, to explain what could happen on March 14th in terms of the funding situation. Right now, we are under what we call a continuing resolution. The budget year ended at the end of September. So Congress basically has extended us under the fiscal year 25 bill. So we're really in a process of using the old bill through March. So we have three possibilities of what could happen. The first is Congress could extend the continuing resolution again in the short term or through the end of the year. So we could have a short-term continuing resolution, we could have a long-term continuing resolution, or Congress could go ahead and pass a bill and get us through the end of the year. And no one knows what's going to happen, but I know I'm watching the fact that the government could go under this thing called sequester, which sounds really both scary and confusing. But that means at the end of April, we'd have an across the board 1% cut. And I think that will encourage Congress ultimately to pass a bill. So they won't have that cut if they do a continuing resolution. So why do I talk about all these kind of confusing legislative possibilities in this webinar? I talk about it because they could impact these programs we're advocating for. And I think our message, short and to the point, is that we shouldn't be affected by these things. The important research in childhood cancer should be unimpeded.
And certainly it opens up, other issues as well. So, for example, the whole area of Medicaid, and nearly half of America's children rely on Medicaid and the Children's Health Insurance Program, and protecting that is very vital. In fact, we are behind a new bill, the Accelerating Kids Access to Care Act, that would reduce the administrative burden for children to travel out of state when they need to seek care in another state. Currently, there's a lot of bureaucratic paperwork and prior authorizations that children have to receive. So, eliminating this would be a huge elimination of a barrier, because it would really impact, life-saving care and critical time. And I was wondering if you could comment on the area of Medicaid and why it's so vital to children.
Yeah, I'd be happy to. I'll both talk about this bill and then Medicaid generally. And it is something we've long supported, and the Alliance for Childhood Cancer, whose Action Day we've talked about many times, strongly supports it. And as I think I referenced earlier, very often when there's a childhood cancer diagnosis, an individual is unable to get treatment in their state and has to go to a nearby, or often not nearby, state for treatment. And it really varies by state how quickly they can get the necessary Medicaid coverage in that state. And thus, if there are administrative barriers or other barriers, that could impact their treatment. And this legislation would really streamline that process. So we think this is a straightforward, simple, yet very important agenda item for our community. And we're so pleased that it's so close to being passed. So that's something we strongly support. And then I would just say in general about Medicaid, we don't have exact data, but we believe that about half the children get their coverage through Medicaid. Often, once diagnosed, these children will go on Medicaid for many different reasons. So protecting Medicaid is very important. And in fact, that's another ask that we have as part of the Alliance Hill Day, and something we support. There have been reports, as some of you may have seen, that the reconciliation process upcoming could include changes and reductions to Medicaid. And I think we, as a community, strongly support the Medicaid program, what it's done for children up to this point, and what it needs to do in the future.
One of the things we talked about is the importance of research and new treatments. And many of the drugs that are being used today, were developed 50 years ago, and cause a lot of health problems for survivors who make it through treatment, including cardiac issues, osteoporosis, other issues related to hearing loss, and there's a long list of things. One of the things that Children's Cancer Cause has worked on is the whole area of survivorship, and trying to get certain administrative actions enacted, as well as legislation. And I was wondering if you could bring us up to date on where survivorship, fits on the Hill, and any legislation that's coming up.
Sure, I'd be glad to, Steve. And I'll just take a step back here too, just to note that since our inception, we've really focused on two areas. We support many things, but I think as a small organization, we've been effective in championing the drug development issue we've talked about earlier, access to therapies, and now the second issue we're going to talk about, and that is survivorship. And this has been a core issue for us. As I mentioned earlier, not every office on the Hill knows about this issue. Late effects are really a thing in many ways that are unique to our population. So we've worked on this issue in the past in both the first and the second iteration of the STAR Act, which is the key authorizing legislation that our community supported, and our organization, Children's Cause, really would help draft those survivorship provisions. We're now working on the Comprehensive Cancer Survivorship Act, and that is a big survivorship bill that impacts both pediatric and adult cancers. And we're pleased that there are two provisions of that bill that are specific to pediatric cancer, and we've been very involved with Representative Wasserman Schultz in helping to draft those provisions. And they kind of wrap together everything we've talked about up to this time. So they deal with survivorship, they deal with Medicaid, and that is because, as we've said, there's a very large percentage of childhood cancer patients who are under Medicaid. And of course, it's a federal program. So it's, from our perspective, the best way to get at this. And what it does is looks at developing best practices, testing these best practices, both in terms of treatment and coverage, and then trying to ideally disseminate these through the Medicaid program across the country. So there are two different provisions in that bill. It was introduced bipartisan and bicameral. I keep saying that, and what that means is it was introduced in the House and in the Senate. I guess in the Senate it was not bipartisan, but in the House it was a bipartisan bill. And it looks like the bill we're working on will be reintroduced again this Congress, hopefully by June. And we think it's very important that we have legislation like that that's out there as a model, even though it's very comprehensive. And we're working to keep the visibility up on the specific provisions we support. And then there are other parts of the bill that are very important as well, that look at research and other items.
One of the things that we often hear from people is, why will people listen to me? I'm just one voice. But we know that collectively, if when people come together, our elected officials pay attention. And I was wondering if you could just share, from your experience, what can people do who are home? They may not be coming to action days, or they may not be on the Hill, but what can they do at home in their districts to elevate these issues?
Well, Steve, I think you raise a very good point, which is that not everyone can travel to DC, number one. And number two, in our new world of the last 5 years, I don't think that's as much of a barrier. So we are able to communicate virtually. The Hill is doing virtual meetings. And of course, we have all these other ways of communicating with policymakers through social media. So whether it's Instagram or Facebook or other means, just also good old-fashioned email. There are many ways to communicate with your members of Congress. Also, there are local offices, which, while they're not the policy centers necessarily for members, they are very often available to communicate and then pass along information. So if you're unable to get to DC, there's still all these other mechanisms to communicate. And one other point I want to make, which is, and you referenced this, Steve, in saying, why is my voice important? My understanding is the reason McCall got involved was a constituent voice, one that got his attention and really meant his long-term engagement and involvement. I know as well, Jackie Spear, former representative who was a former caucus co-chair as well, had a constituent who really engaged her. And I know in my time working on Capitol Hill, there were some meetings where someone came in with a really unique perspective that ultimately resulted in the introduction of legislation. So your voice is important. The other thing I might say is don't necessarily expect that kind of dramatic response I mentioned. It is a long game. So you're really developing a relationship and like any relationship, tend to it through whatever mechanism you're using over time. And then hopefully that will yield the sort of process of interaction you need.
And I think it's fair to say that offices do track daily the amount of calls, social media messages, emails they get, and what issues their constituents care about. So it is important, and I think that perhaps we underestimate the impact that just one contact can have, because when they're tallied up cumulatively, they start to get into the large numbers, and people start to pay more attention.
Yeah, Steve, I think that's an important point because, especially the bit, I worked for the state of Florida, very large state. You're not going to be able to um, get into the senator to talk. So it's critical that these offices track, and they do. They very much do track that. So all these different voices and means of communicating are very important and very much responded to.
And the other thing I wanted to mention is Children's Cancer Cause has a advocacy toolkit that's downloadable and has some practical tools on, how to ask for a meeting, how to conduct a meeting, how to send a letter to Congress, how to, post an effective social media post, and how to work with others in coalitions, and attract others to the cause. So these are practical, hands-on resources that we have available, and we hope that people will use, and teach others on how to advocate, and working together. So just in closing, were there any other thoughts you had, Sue, today, thinking about the landscape, and what's important to members when we talk with them?
Yeah, well, you mentioned coalitions, Steve, and we work very effectively in coalitions, and I think it has maximized our voice and shown that there's consensus in our community. So, I encourage you all as well, where possible, locally, to join with others. It's always helpful to have that the opportunity to work with others and to form your own local groups. It can be very informal. There's no requirement for it to be a huge undertaking, but working with others, both in the short term and long term, to achieve your goals is a very, very effective means.
And you mentioned that this is the long game, and advocacy is a process, and these are important issues, but take time to solve. And we've made a lot of progress, I think, since Children's Cancer Cause started 25 years ago. But I think we're also realistic that the same challenges remain. And despite the progress, we have huge challenges ahead. So I think we might want to borrow from your description of the long game for advocacy.
Yep, please do. It's very important. And, you know, in life, repetition is the key, no matter what you're doing. But I think in the work we do, it's important. Often here in Washington, the loudest voices get heard, or the most frequent voices. So folks should not be shy and stick with it.
Great. Well, thank you, Sue, for all you do for Children's Cancer Cause and for our community. And
Thank you, Steve, as well. We have a wonderful longtime collaboration here at Children's Cause.
Thank you, Steve and Sue, and thank you all for being here. We hope you found this useful and informative. We really need your voice now more than ever as things heat up in Washington. So stay involved, stay engaged, stay informed. Be sure you're part of our Kids Action Network and watching your emails as you get updates from us over the coming months. And please let us know what you thought of this webinar and what else you would like to hear us cover in the future. Thanks.